Hello, my name is Dojna Gavrilov, and the article I present for the 18th International Conference on Interdisciplinary Social Sciences in 2023 is entitled A New Theoretical Approach to Social Well-Being, the Romanian Case Study. The study analyzes the way well-being is defined in both the academic and the social environments and proposes a new approach to it. Today, the concept of well-being is associated with that of welfare, in the idea that the human being has a set of needs that, once fulfilled, guarantee happiness. In a modern society, well-being is generally described as follows: the state of feeling healthy and happy, with welfare as a synonym, and welfare is defined as help given especially by the state or an organization to people who need it because they don't have enough money. And the Merriam-Webster definition is the state of being happy, healthy, or prosperous, with welfare also as a synonym, which is defined as the state of doing well, especially in the respect to good fortune, happiness, well-being, or prosperity, and aid in the form of money or necessities for those in need. Now, we see that often the concept of welfare is considered a synonym of the well-being, but the reason this is so is because well-being is now commonly identified as a goal of public policy, which works in numbers and statistics, thus adopting this economics perspective. Now, considering this, we ask ourselves, what is the true meaning of well-being, and to what extent the economic means can guarantee well-being? For 95% of the world population, well-being is about measures of law and order, food and shelter, work quality, health, standard of living, citizen engagement, migration, intentions, view of governance, and demographic variables, as Ditton showed us in 2008. Meanwhile, well-being is associated with mental health or financial well-being, when others prefer to include both aspects, like Dwyer and Diener and Scollon and Lucas and Adler and Seligman. Yet, how well can we measure well-being by referring only to aspects such as income, gross domestic product, and access to resources and the standard of living? In 2008, Ditton studied how countries' income affect people's health, satisfaction, and well-being. The results show that countries like Ghana, Denmark, Venezuela, Brazil, and USA register high level of life satisfaction, while countries like Bulgaria, Moldova, and Lithuania register low levels of life satisfaction. The GDP for these countries does not correspond with the levels of life satisfaction, thus are not necessarily representative for social well-being. That is, because GDP covers more than just people's income, it also encompasses investments, which do not always and immediately lead to social welfare. Most studies show that GDP is a macro aspect, but the well-being measurements must also consider the micro aspects. Well-being and happiness depend also on the subjective feeling of happiness, as Grieve Bent showed us in 2008. The positive emotions and capacity to flourish simultaneously in multiple domains of life. And this is how the levels of happiness from Ditton's study based on GDP measurements register a different level of life satisfaction than the country ladder measurement as shown in this figure. Different from GDP-based life satisfaction measurement, the country ladder illustrates individuals' contentment regarding their income, which is different from the country's GDP. This is why Ghana, with such a big GDP, is lower on the country level measurements than Moldova with such a small GDP. Aspects such as GDP matter, but not when the minimum wage is not adapted to it. This is how Moldova got a higher life satisfaction on the country ladder. In 2023, the monthly minimum wage in Moldova is of $2,017, while in Ghana is of $25, which is a big difference. So what measurements can we trust, and what really represents well-being? It is that in 2013, Esterlin showed that individuals compare themselves to people within their country and from other countries by traveling or via TV. This is how income alone does not affect happiness, but the individual definition of happiness and what he saw and thinks that happy life should look like. Also in 2008, Grieve showed that in the case of nations reaching a certain level of economic development, the non-monetary aspects become more important than the monetary ones. This is how we get a decreasing poverty rate and an increasing rate of mental problems worldwide, as showed in the figure. Now, if we were to make a clear difference between the concept of well-being and welfare, then in addition to what we mentioned previously, we should consider the following aspects. Well-being must be seen in terms of social value, while welfare is about an economic perspective of utility. And also, financial resources alone are not enough to reduce poverty, improve health, and create a good family. Thus, well-being is about more, namely a great mental health, independence, social activity, a great living environment, life quality, as Svetkodol showed in 2014. So, what is well-being about? We have multiple approaches on well-being. The eudaimonic view says that well-being is the human capacity to exercise and dispose psychological or behavioral abilities to follow a good life, which is about having a good mood and mental strength to decide what is the best for yourself. The utilitarian view says that well-being is what really matters, thus transforming well-being in a goal of life. The social constructionist view says that well-being is a way of living and a social construct in itself. The constructivist view sees well-being as something shaped by the individual that permanently reevaluates his wellness in presence of great factors like modernity, technologization, globalization. And there is also the self-determination theory, which considers that well-being is about feeling good, about the individual capacity to fulfill his needs like relatedness, competence, autonomy, which are constantly changed and do not rely on a constant set of resources. Given the importance of resources in defining well-being, we focus on the case of Romania to verify to what extent resources influence the degree of happiness of Romanians. Although Romania left the communist regime in 1989, the degree of happiness and life satisfaction started to increase relatively from 2010. As we can see in figure 4, there were years when people were more dissatisfied with their lives, like in 2005, 2006 and 2010, compared to the previous years, which made us question their definition of happiness at the time. So we addressed a questionnaire to 100 Romanians with a job and analyzed the impact of different aspects on their happiness and life satisfaction. The first aspect we checked was their job, their resources, and how this influences their happiness. In figure 7, we see that jobs have mostly impact on personal life and on human health. This is how we see that 48.4% of our respondents consider the job too demanding, 30.5% say that they have too less time, 28.4% argued they do not like the job at all, 18.9% say their job affects their health, and 6.3% say that their job affects their family life. Given that the free time we have is crucial for balancing the other aspects of daily life, we asked our respondents to what they allocate their free time. And we see in the figure why they consider they have too less time free for balancing all other areas of life with work. Work gets to affect their personal life in terms of family, relationships, personal development, belonging, and other aspects. We may think that the weekend days should be enough, but 60% of our respondents say that the 2 weekend days are not enough to rest, develop personal relationships, and practice a hobby. And this happens in the context where only 23.5% of the respondents are married. So we focus further on the impact of resources on the Romanian well-being. We asked the interviewees to indicate an interval in which their monthly salary fits. And we see that 58% have a monthly salary over 3,000 RON, of which 43.9% have a salary of more than 3,500 RON, in the context where the median salary at the moment we took the questionnaire was of 3,217 RON. In these conditions, we focus on evaluating their happiness level and ask them to consider their life and evaluate whether they are happy, partially happy, or not happy at all. The results show us that 11% find themselves not happy, 42% are partially happy, and only 47% are happy. Considering all this data, in the first instance, we understand that well-being is not a stable concept and cannot be stable as long as there are different cultures, traditions, life experiences, and perspectives that change the way we formulate our needs, preferences, and the way we see a great life. So we turn towards the adaptive theory, according to which we define well-being as a state of mind and de facto that illustrates the way in which individuals evaluate their life satisfaction, modify their needs and expectations, and adapt to the times and contexts they live in. Well-being is constantly influenced by these factors like society, environment, family, job, and others, and internal factors like individual experiences and the interpretation of well-being through the prism of all these experiences. These factors define the conditions in which society is and automatically redefine social needs. Although in general the external factors are common to all of us, but the intensity with which we interact with them and the internal factors put a special mark on the way we see life, establish expectations, evaluate our life quality, and feel about ourselves and the ones around us. Thank you for attention.